And well, with the union budget scheduled to be presented on Sunday tomorrow, all eyes are on what the Modi government has in store for the healthcare sector. The economic survey highlighted key areas needing urgent government attention. Getting you all the details in this report.
The union budget is all set to be presented, and all eyes are on what the government has in store for the healthcare sector. 6 years of the pandemic, and with the burden of metabolic disorders on the rise, along with the challenges of digital screen addiction, the big question is what will be the top focus as far as the health of the country is concerned. The economic survey pointed out the areas that need urgent work, highlighting that obesity rates are increasing across all age groups, saying that hiking taxes on junk food would help.
We should try to avoid consumption of ultra processed food, ultra processed pizzas, and frozen foods like frozen chips and fried chips, as well as cold drinks. They contain lot of chemicals which definitely affects our heart. It increases the concentration of bad cholesterol, which is also called as LDL in our blood, which eventually affects our entire body.
The economic survey has also red flagged digital addiction and urged social media reforms.
Excessive use of digital media in children is impacting their mental health as well as emotional well being. Clinically speaking, it affects their focus, their concentration, their memory, the interest in studies, and subsequently decline in their academic performance. As nutritional balance is important, same way is digital balance. So, technology should not replace our life, but it should support it, it should balance it.
India continues to underinvest in the health of its own people. India's public health spending as a proportion to the GDP is currently lower than both of Bhutan and Nepal. According to recent analysis, India's overall health spending stands at 3.3% of the GDP, but when only public expenditure is considered, it drops to 1.84%. In contrast, Nepal allocates 6.66% of its GDP to healthcare, and Bhutan also surpasses India, dedicating a higher share of its national income towards health. In comparison, Afghanistan, ruled by the Taliban since 2021, spends 23.09% of its GDP on health, largely due to a low GDP base and high out-of-pocket spending. Nepal allocates 6.66% of its GDP. Sri Lanka, Bhutan, and the Maldives also outperform India on this count.
We need to look at increasing GDP spent on healthcare to at least above 2.5% because that can be utilized to stimulate, organize, and propagate healthcare in our country. That should include diagnostics and critical care in underserved areas of the country, connecting the underserved areas with the prominent metro cities where healthcare facilities are good by use of AI and technology, creating preventive healthcare in the country so that overall burden on the health can be reduced, and starting community based programs in the country to look at simple deficiency things like anemia and vitamin B12 deficiency.
Sustained spending on public health would have positive outcomes for the economy as well, a sentiment recently echoed by former IMF chief Gita Gopinath, who spoke about damage to the economy if the air pollution problem is not fixed. What does it mean really for you? It means that your out-of-pocket expenditure also goes down. Remember, the peak of the pandemic saw the government spend 1.08 lakh crore for health, but after the emergency passed, the spending dropped sharply, even to just about 83,000 or so crore at one point in time, which is 2023 and 2024. Health clearly receives less funding that the world's fourth largest economy needs and needs urgently. In New Delhi, Sneha Mordani for India Today Television.